Well, welcome. I'm Mary Gannon Kaufman. I'm a registered dietitian. I've been a certified diabetes educator, and I'm a healthcare chaplain. So I have a real heart for people that have diabetes. Many members of my own family on both sides, my mother and my father's side, aunts, uncles, grandparents, cousins, they all have type 2 diabetes. So I want to share some ideas that might really revolutionize how you're thinking about it. So let's take a look. We kind of know this, understanding diabetes. Type 2 is the most common disease in the world, actually. Diabetes is, and 90% of diabetes cases are type 2. Globally, there are 537 million people right now with type 2 diabetes, with projections to be 783 million in 2045. So we know this. It's a chronic metabolic disorder. It comes with insulin resistance, impaired insulin secretion. You're elevating blood sugar levels after you've exhausted your beta cell function. And it brings significant complications that people really worry about. Cardiovascular disease, neuropathy that can be really nagging and painful, retinopathy that can really limit our functionality, kidney failure, and increasing levels of anxiety and depression. And this all brings a poor quality of life. And what we notice is it's the quality of our patients' self care. So we do so many things to try to motivate them, give them good information, help them learn techniques. But are we missing something? And I'd like to suggest that we really are. Now, if we take a look, we're learning more and more that health is more than just technical medical physiology that's functioning well, that it is a state of balance on all levels of the human person: physical, mental, social, and spiritual well being. We see that from the World Health Organization from 1983. And the Joint Commission, if your facility is credentialed by Joint Commission, they are saying since 2018 they've had this requirement that all members of the healthcare team need to be credentialed and trained to address spiritual needs of all. That means that all people can, we look at the literature, all people have spiritual needs, not necessarily religious needs, but needs for existential well being. And that's a big word: meaning and purpose and relationship to something bigger than themselves. When you get diagnosed with diabetes, a metabolic illness that's not going to go away necessarily, unless we catch it real early, you turn to something that's beyond you. So all healthcare, if you're working in palliative care, some people with diabetes might move into palliative care eventually if they have a lot of these comorbidities. So the National Consensus Project for Quality Palliative Care says that all healthcare providers need to assess religious and spiritual or existential needs. And interestingly, in 2024, the American Medical Association came forward with Resolution 304A24 that all patients have spiritual needs that need to be addressed in primary care, and all healthcare providers need to have medical education that includes spirituality. So, what do we mean when we say spirituality? Now, that kind of sends the hair on the back of a lot of people's necks to stand up because we think we're pushing religion, and that's not what we're talking about. That we look at spirituality, all people have a need for meaning and purpose and interconnection to other people and the sacred. So just think about yourself, whether you're religious or not, how renewing it is to go out into nature. I live in Colorado and I'm surrounded by beautiful mountain peaks. Just going out there is a spiritual experience, something beyond me, something that's bigger than me. If we look, diabetes distress comes when people's existential needs are not addressed. So it's real and it's often unaddressed or underaddressed in ways that really make a difference. So if we look at how to define diabetes distress, It's an emotional or an intrapersonal burden. They're feeling weighted down with the burdens of managing this chronic disease. They're also worried about healthcare access and physician related struggles. Many of us as clinicians, not just physicians, we get trained, we don't have much time, and we're spit spat, we're on the technical stuff, and we don't take time to say, well, how you dealing with all of this? And they also, spiritual diabetes distress can come from the regime, the personal daily regime, and the self-care distress. And it changes our interpersonal dynamics. Maybe we've always been the one that stirred all the potlucks or got all the people together and had good food. And now that's all seeming to change. Now, let's look at spiritual health as a direct remedy for diabetes distress. We want to learn how to incorporate this holistic lens in the care that we provide. So spiritual health is really a dynamic and developmental, a conscious process, a universal desire, and there's many dimensions to spiritual well-being. So let's take a look at what we mean. This is quick, but spirituality is this dynamic and intrinsic aspect of humanity that people seek ultimate meaning, purpose, transcendence, and experience, and relationship to self and family and others, community, society, nature, and the significant or the sacred. This is from Pekelski from 2014. It's a definition that's come out of palliative care. But when people are confronted with a disease state or a change in their metabolic state that they didn't know they were causing, and they can do limited things to stop it, it makes them look beyond themselves. They get rattled. So religion is that search for significance within the context of an institution. Hopefully people cultivate a spirituality, things that renew them, and they find other people that seek spiritual health in the same way, and they pursue it along with them. Then it becomes a religion, kind of a religious perspective. So let's take a look at what the research says. A really interesting study by Berkowitz et al. From 2023, and also Gaiman from 2022, and Rasmussen in 2013, all said that positive spirituality, positive sense of meaning and purpose lowers all-cause mortality. It lowers waist circumference, something that we're trying to, especially people coming in with pre-diabetes and early diabetes, we're trying to help them manage this weight issue. And it decreases abdominal obesity and increases consumption of fruits and vegetables. So it changes our taste preferences. So it's really an unutilized aspect of holistic diabetes care. Most of us are trained as scientific centered medical technological, if I get the words spit out right. Our training is really focused on technology and science. Now, what we're finding is there is a lot of evidence-based research on this new field of spirituality and health. So really, diabetes management is just much more than working with what the pancreas is doing. So it's a new discipline of health that's come to forefront in probably the last 30 years. Large studies are calling spiritual care and spirituality are strong social determinants of health. And that many practitioners, we doubt that there's evidence that support it. I tried to send an article to Dietitian Today, today's Dietitian, and they said, well, we only publish evidence-based science work. And there is a lot of growing evidence on the impact of spirituality and health. So we are often, this is one key modulator of working with self-care behaviors that we are missing. So really, enhanced spiritual well-being, the research shows clearly in large, consistent studies that are recent that spiritual well-being directly decreases diabetes distress. So there's a direct correlation to positive self-care behaviors and problem-focused coping. And positive spiritual well-being increases problem-focused coping and it increases self-efficacy, self-esteem, and motivation for living well. So spiritual well-being that includes existential and this transcendent or religious parameters is really connected to decreasing diabetes distress and increasing motivation for health. And if we can tap into how a person is wired, religious wise, spirituality wise, we can allow them or help encourage them to set goals that incorporate their spiritual perspectives. If the research shows if we come from a Judeo-Christian perspective, we tend to pick goals that are high intensity goals. And if we come from more of a Buddhist Hindu background, we tend to focus on goals that are lowering arousal. So for having higher consciousness. So basing our goals on how a person is wired is super important. And all of us can learn this with some simple questions. One question you might want to write down: what do I need to know about you to give you good care? Do you have any spiritual, religious background? That's kind of a history taking that can help you key into people's backgrounds. When do you feel most alive? Those are all simple questions to move into this existential care. And you might complain, I don't have time to provide this other element that reduces spiritual distress. And I like to say, you don't want to miss this. You don't want to miss this time. Short, focused moments where you give eye contact, show the client that they matter. You're not just there to give them information and technical training, but you care about them, if they matter. You give them undivided attention. 2 or 3 minutes even can make a huge difference. So really, practitioners can't give what they haven't cultivated in themselves. No matter what your religious or spiritual background, you need to develop some reflective processes, some reflective journaling. So maybe at the end of the day, some rituals that help ground you in what makes you tick, what means matter, meaning, and purpose for you. So maybe you keep a little journal right there before you leave your desk to write down the highs and the lows of the day. What did you learn on that inner level? Discover the inner voices that inhabit you, where you find your well-being. Is it religious practices? For me, I teach this broad pastoral lens, but I myself come from a religious perspective. So sacred texts, prayer, joining in community liturgy or worship is really meaningful to me. But figure out what it is for you. Maybe you recoup some of your earlier background and bring it forward to today to see what matters to you. So self-reflection is a way that you can develop that spiritual sensitivity to have a healthy alliance with your clients. Self-reflection awakens you. And what's more, to become a thoughtful practitioner, you want to be able to understand other people's core values. You want to be able to recognize in their story, in their narrative, what are the spiritual themes. So there's interesting, if you come from a faith-based background, that can be an asset in recognizing spiritual themes. You're more spiritually sensitive, potentially, if you have a positive faith perspective of your higher power. But it can also mean if you're a faith-based provider, you only work with people that are wired the same way as you, and you're uncomfortable working with other perspectives. And also, you oftentimes fail to address those existential aspects, what's underneath or what girds a religious faith. You don't ask a person, does it give you, what grounds your life? What energizes your life? Where do you find joy? Where do you find connection to something beyond yourself? You might think about belief and that kind of thing. So faith-based providers need to expand their lens, and secular providers have never thought about this stuff. Consider it. So really, I'm suggesting that it should be part of standards of care for all people in diabetes centers, that practitioners want to address whole person aspects of care, know how to do a spiritual assessment. You need additional training, and I offer a short training process that's really cost effective for continuing medical education. So practitioners need to go beyond just understanding what spirituality is and handing a person an assessment tool. You want to be able to observe spiritual issues and how are they dealing with that? How are they finding well-being from those practices? You could give a short spiritual assessment tool, and I will attach a PDF to this video, that a simple spiritual care tool that you could use on admission. But I would encourage you to ongoing observe how people are doing on a spiritual lens, ongoing as you work with them, and learn some simple spiritual interventions. Because if we don't, many people, most people, spiritual needs will go unaddressed, whether they are worshiping in a religious community or not. Spiritual needs related to their well-being that are stirred up by the distress of their diabetes will go unnoticed unless the diabetes practitioner learns how to recognize a spiritual need. And that will stir lower motivation, and it'll increase systemic inflammation. Imagine if somebody has a deeply held burr in their soul, we can give them all of the diabetes education we want, and they're not going to be motivated to follow it unless we give them space to unburden themselves. So we want to learn some common spiritual interventions that would fit into most people's narratives. But if a person has complex or long-standing or deeply held distress, spiritual distress or grief, we want to know when to refer them also. So consider there's several ways to get this human formation. I have 3 spiritual care courses. 2 are evergreen courses that are 5 to 6 CEUs each that are real cost effective. One is 2 sessions of spiritual care tools that you could watch anytime, anywhere, and 2 sessions on grief care, because grief is part of most of our stories. And then if you'd like to really be able to put rubber meets the road, to take the knowledge you have once you've cultivated it and put it into mastery, I have an 8-week training that's live and interactive, virtual, but interactive, where you get a lot of hand holding on your particular mode of giving care. So that we're each going to offer this uniquely. We all have different gifts and ways and strengths and means, but this knowledge to mastery, this live virtual training, can help you really amp up your own style of care. Here's my contact information, mary@renewedpractitioner.com. If you'd like more information on my 3 trainings, renewedpractitioner.com is my website, and my phone number is 720-432-7457. So I've really enjoyed spending this time with you. Here, once again, my contact information. But there is so much more that we can learn in providing spiritual care to the patients that we care about. So it's a lot more than just helping them know what their pancreas is doing. It's much more than the technology. Even though we want to have good technical skills, we want to be able to bring in that full lens of diabetes care. So thank you so much for spending this time with me.